The ongoing government shutdown has reached a critical juncture, with Senate Democrats standing firm on their demands for healthcare benefits. This is a bold move that has left many wondering about the potential consequences. For over 2 weeks now, the standoff has paralyzed Congress, leaving federal workers in limbo and creating a daily drumbeat of votes on funding bills. House Republicans have even left Washington, highlighting the depth of the divide. But here's where it gets controversial. Senate Majority Leader John Thune, a Republican from South Dakota, has tried to pressure Democrats to back down. He argues that every day without a resolution means smaller paychecks for more Americans. Thune's efforts have been in vain so far, with Democrats insisting on a guarantee to extend subsidies for health plans under the Affordable Care Act. Democrats warn that millions of Americans who buy their own health insurance, including small business owners, farmers, and contractors, will face large premium increases soon. They believe that voters will demand action by Republicans, especially with a November 1st deadline looming in most states. "We have to do something," said Senate Democratic leader Chuck Schumer. "Republicans are letting these tax credits expire." And this is the part most people miss. While Democrats hold out for a deal on healthcare, they also acknowledge the urgency of striking an agreement to prevent large increases for many health plans. During the pandemic, when Democrats controlled Congress, they boosted subsidies for Affordable Care Act health plans, leading to record-low uninsured rates. Nearly 24 million people now rely on these subsidized marketplaces for their health insurance, according to KFF. The expiration of these tax credits could have a significant impact, with many people potentially foregoing insurance if prices rise dramatically. Senator Patty Murray, the top Democrat on the Senate Appropriations Committee, has heard from families panicking about doubling premiums. She warns that this could lead to small business owners abandoning their jobs to seek employer-sponsored healthcare elsewhere, or foregoing coverage altogether. Murray also highlights the potential ripple effects across the medical insurance industry if many people leave their health plans. This could result in higher prices across the board, shrinking the pool of people under health plans. Some Republicans, like House Speaker Mike Johnson, have called the COVID-era subsidies a boondoggle, arguing that subsidizing the healthcare system leads to increased prices. However, there is no clear consensus among the GOP on this issue. President Donald Trump has expressed a desire for a great healthcare deal, but has not actively engaged in the debate. Thune insists that Democrats first vote to reopen the government before any healthcare negotiations. If Congress were to negotiate significant healthcare changes, it could take weeks, if not longer, to reach a compromise. Meanwhile, Senate Republicans are setting up a vote to proceed with funding for the Defense Department and other government areas, potentially paving the way for troop salary payments. Thune sees this as a step towards traditional government funding through annual appropriations. The votes on appropriations bills may not immediately fix the government shutdown, but they could shift the Senate's focus to issues with bipartisan agreement. What do you think? Should Democrats hold their ground on healthcare, or is there a better way forward? We'd love to hear your thoughts in the comments.